Well, thank you for holding today's hearing on strengthening primary care. Americans spend more than $4.3 trillion annually on health. Our spending has more than tripled as a percentage of gross domestic product since 1960. Growing healthcare costs don't just strain the American pocketbooks. These costs also are a major driver of widening budget deficits and the federal government's unsustainable fiscal outlook. And it's clear that we're not getting our money's worth for all of this spending. Major healthcare program spending eats up 32% of the federal revenue today and will be 45% mid-century. Our healthcare system has plenty of waste and inefficiencies that need fixing. Increasing transparency and competition, fighting fraud, and getting rid of red tape are some key areas where we ought to find a bipartisan start. We can also do a better job reducing clinical waste by focusing more on prevention and early intervention, reducing inappropriate care, and also improving care coordination. Having access to primary care is key to being able to do all of these things I mentioned. When patients have access to timely primary care, they have better health outcomes and live longer. We're blessed with millions of dedicated and qualified healthcare providers. These individuals care deeply about the quality of care that they provide. I'm proud that Iowa is home to several great institutions that train primary care doctors, physicians, assistants, nurses, therapists, and more, too many more to mention. Rural primary care depends on a suite of providers, meaning doctors, physicians, assistants, nurse practitioners, along with telehealth and other innovations to deliver timely care. To make primary care more accessible and effective, we need to remove federal government barriers, lean on consumer choice and price transparency, and be outcomes-based. Too often, Medicare regulations and payment systems are overly burdensome for physicians. Government-driven approaches haven't moved our healthcare system to be more outcome-based. The future of Medicare payments to providers and improving access to primary care lies outside of the fee-for-service so patients and taxpayers can get better value. The key question is, how do we actually do that? Who's in control, and what can lower costs and at the same time improve health outcomes? Last October, this committee held a hearing of reducing excess costs in health care. I'm glad that we took an accurate account of what's working and not working and reducing our nation's health care costs at that hearing. Now, the Congressional Budget Office has found the Center for Medicare and Medicaid Innovation, a program created to lower costs, has not lowered Medicare costs. That's not my judgment, that's CBO. CBO told us what is lowering healthcare spending in Medicare is the Part D program. In the past decade, existing brand name drugs lost their patent protection. As a result of new competition from generic drugs, patients are shifting to less expensive generic formulas. This is in line with what we already know from CBO. In the first decade of the Part D, it ended up costing taxpayers 36% less than projected by CBO, and that doesn't happen very often. As then chairman of the Senate Finance Committee, I was proud to author Medicare Part D. Prescription drug costs are still too high. We need to reform the role of the very opaque middle men, and you know them as PBMs or pharmacy benefit managers, and we need to enact more competition into the drug market. We know that market-based solutions are effective in lowering costs and improving care, as we have seen, as I just stated, in Medicare Part D. We should build on these policies. While seniors should get a choice between fee-for-service Medicare and Medicare Advantage, we know that Medicare Advantage is a growing choice of many seniors. Medicare Advantage can be effective at promoting value in the health care by directing resources in primary care and higher quality care. As Medicare Advantage adds more patients and spreads billions of dollars of taxpayers' money, aggressive oversight is needed to root out fraud, waste, and abuse that's been a focus of mine for many years. Finally, we can't talk about waste and inefficiency in health care without discussing our country's fiscal situation. According to CBO, the federal budget deficit in the fiscal year that most recently ended clocked in at $2 trillion, and future deficits are projected to be even larger. Growing health care spending is a major reason. Health care spending can be made more efficient without compromising the quality of care and reducing access, especially in rural areas where access is a major problem. I look forward to this hearing from our witnesses and thank them for appearing because this issue of more primary care is very necessary to be solved if we're going to reduce costs.